Hi, I'm Akhilesh Ratnam and I'd like to welcome you back to This is Medicine. So, This is Medicine is a webinar series that we're doing, as some of you may know, that focuses on a different specialty each session and provides some insight into what it takes to excel in certain specialties, any misconceptions surrounding them, but also how you can maintain a healthier work life balance in a career as stressful as healthcare. So, every session consists of a parent and a child, and last session we spoke with Rupa Jayaraj and her son Paul Sundaram, and it was about anesthesiology. And this week, we will be gladly speaking with Dr. Anandhi Inbasagaran, who is a consultant paediatric psychiatrist, and her daughter Mohana Kumar, who is a med student at University of Manchester. And they'll be being interviewed by Akash Ratnam, who is a med student at King's College London.
So, hi everybody. Thank you for joining us today on our King's Coronation Day. Some people think that learning about medicine and the wonders of the human body is more important than the King's coronation. I agree. So, thank you all for joining us today. So, today I'm being joined by Dr. Anandhi Inbasagaran and her daughter Mohana to discuss child psychiatry. So, I'd like to ask quickly, Doctor, what does child psychiatry really entail?
Okay, so essentially, child psychiatry is working with the mental health difficulties of children and young people. So essentially, you train to do your general medical school. So in a sense, you develop all the skills that you need to be a holistic sort of a doctor, and then you train in psychiatry. So in this country, what you would do is this would mean is after you do your core training in psychiatry, and you pass your MRC psych exam, and then after that you can choose a subspecialty. So the specialty could be adult or geriatric, and you can also choose child and adolescent psychiatry. So in this specialty, again, there are particular areas that you might like to focus on. So you could work with, say, with eating disorders, which is a very upcoming field now because there's an increase in the prevalence of eating disorders. Or you could do work with forensic with the Mental Health Act. So you could work in forensics. Also, you could do something linked with a pediatric liaison, which is worked with the hospital and with children and young people who have a physical condition as well as some mental health difficulties. But typically, what a child psychiatrist would be is that you would be talking to children and young people about their various mental health difficulties. You'd be liaising with schools. So the common sort of presentations that you might have, that somebody is very anxious, they're low in mood, they're not going to school, there's problems in getting along with other children, there's sort of fights, there's self-harm, there could be, risk, ideas of, wanting to harm themselves, taking overdoses. So this is generally what a sort of a child psychiatrist might be doing.
I ask a little bit about some of the other specialties that might, interest other people within child psychiatry. Just what else would there really be? So you mentioned like forensics, which is that's actually something that I was interested in when I was looking into psychiatry. Of course, I'm veering towards surgery myself, but I always thought that psychiatry was really, really interesting when I started doing my mental health placement. But could you give us a bit more insight into things like that?
Okay, so you all one of the most upcoming fields actually is in eating disorders at the moment. So there's been a lot of national funding because there's such a huge increase in the prevalence of eating disorders among children and young people, particularly after the pandemic. It was always a sort of an issue. So we have specific and specialized eating disorders units. And these can be, again, community ones, or they have links also to the inpatient unit. And I think that's a nice specialty for people who have, who like if you like their medical background. So who like, because there's a lot of physical health difficulties. It's closely related to if you want to, even if they get so thin that you've got to feed them, you've got to do the nasogastric tubes, you've got to monitor that. So that's a specialty which crosses across physical health a fair bit. And then there are components. If you also like working under the framework of the Mental Health Act, there are legal components to it as well. And it's also quite, it's an opportunity to do a lot of research too, because it's seen as having outcomes, parameters, a little bit more hard data. So that's the eating disorders as a specialty. Forensics is, again, I think has a lot of, again, links to neurodevelopmental conditions, because you find quite a lot of young people who present in the forensic setting, either because they've had links with the offending system, with the youth offending system, they come along with the legal framework. There's a lot of assessments and also risk management. So I think that's it's quite an interesting, if you like that sort of a specialty, that's an interesting thing to work in. The other branch also is the inpatient unit. So where you work as part of a team. And I know I was talking to Mohana about this, and Mohana was saying, some of us quite like the hospital setting. It seems nice to work as a different sort of a hospital team. So where you're doing in-depth assessments, you might do in-depth management. That's the hospital component of working in child and adolescent psychiatry. A large part of it is community work. You are doing sort of community work, and your interventions are largely psychological forms of intervention, managing environments, and then medication. So these are the sort of the sort of people are branching out to do lots of work. So you can do outreach work. You can go into doing outreach units, which go into the homes, where you provide some medication, some risk management. You could also, work along the early intervention teams, which are looking at if you have young people who present with psychotic episodes, serious mental health issues, which are there in adults, but you sort of see them earlier.
So there was a lot there. So firstly, thank you for that. I actually learned a lot that I've never heard before. So that was really really interesting. But one burning question I really have to ask is, with regards to specializing, are there any other specific sort of examinations or certifications that one would have to get before registering themselves for such a subspecialty in child psychiatry? Or would it be more of an interest type of thing?
No, not a certification as such. So you would have to pass your MRC psych exam, which is, like any other exam that you have at the end of your core training. And then to get into the specialty, it's just an application for getting into the specialty. So obviously, they look at your portfolio, what sort of things you're interested in, and then you apply for interviews. We do have some credentials now, which are like programs which you can sort of use. So for instance, I think there are ones on eating disorders. Not sure what else is there, but you can do a credential, which is essentially a year program. So it's not like a certification, but it's rather like an experience, so then if you wanted to apply for a particular specialty, you could say, I've done a credential in this. So that, but otherwise it's your exam, it's your MRC psych exam, and then you're good to go for any specialty. Well, you can apply for any specialty, really.
Are there any like massive differences that you could say between like from when you applied to psychiatry to when, say, if I did, or any of our viewers did? How would you say the pathway is different, and would there be like any tips that you could share with us on getting into it?
Okay, the pathway isn't dramatically different. What is different is, I think, is the need. We need more child psychiatrists than ever. So if anything, it is a specialty that has, it's open for, if people want to I always say it's a very good specialty. It lends to easier working hours, more flexibility. So if anything, there's the demand for child psychiatrists is much more. So the pathway is still the same. I mean, we at the moment we are managing to fill more or less our SPR, our SPR sort of our specialist sort of posts, but we've had time periods when we've not, and still we've got this gap at the consultant level. So where we are really we're looking for child psychiatrists. I mean, I still get loads of emails asking, every week whether I would consider working somewhere else in the country, because a child psychiatrist. And I know we are struggling to we've had a vacant post now for about 2 years, and we've not had any takers because there aren't enough of us to go around at the moment. So I think for those of you, for you, Akash, Mohana, and the rest of you, I think by the time, if you do choose to do this as a specialty, I think psychiatry on the whole, still there are lots of vacancies.
Mm. And of course, we can't really underestimate the importance of psychiatry in today's society. I feel like it's often overlooked, or it has been overlooked until recent years, wherein it's just as important, if not more, I feel. Because a lot of people don't really discuss mental health. It's very easy to come into the hospital and say, my hand's broken, I've got a cold, but actually talking about deeper psychological issues it's always been a point of taboo, I feel, until quite recently.
Well, and I think that's even more so when you think about children and adolescents, because who does our referral comes from? It's not the child or the young person who walks through our door saying, I've got this problem, can I have help? It's very often not the, when you're looking at the older adolescents, probably are over 16, possibly. But in the vast majority of cases, the person who is referring to us is the family or the school or social services or someone else. So we rely heavily on other people picking up difficulties, and that's why a lot of our work is liaising with schools. It's liaising with any other services that are involved. Now that's very nice if you like that kind of work. So maybe I should talk about, I was thinking about, Mohan was asking what are the qualities you need to be a child psychiatrist. And I think it's not just the qualities. I think the qualities most medical students will have, it is the ability to communicate, to listen, to have an understanding of somebody else's suffering. The qualities of it. I think it requires some interest. You have to be interested in listening to people's problems, in knowing what makes them tick, what's causing the difficulties, looking at all the systems around them that are causing those sort of difficulties. So I guess there has to be an interest in emotion, in other people's emotions, an interest in behavior. It is a behavioral science. I mean, I say at the end of the day, it is so much of it is a science, because so much of it is based on what you observe and how you come to a formulation. But the rest of medicine, it is a little abstract. But you've got to enjoy it. You've got to enjoy. Otherwise, it would lead to burnout. Listening to problems, other people's problems, suffering. Knowing it's, like you said, a bit of it's a hidden issue. It's not like a broken arm where you can come and say, I've got this. So often it's children and young people don't know what's happening with them, so they will present with a lot of confusion. And so it is knowing that, is being able to read those and come to a formulation about what might be causing this sort of difficulty.
So actually, one word that I really wanted to pick up on in that discussion was the word burnout. I think that's been discussed a lot more in medical literature and general news as well. How do you think it would be best? Actually, how do you as a medical professional deal with burnout?
Well, I always say this to my colleagues, and I say this to my patients and the families. I try to practice what I preach. You work in mental health. I think I think you can get burnout being in any specialty in medicine. And I don't think that's particular to now. People sometimes say it is now that you have more. I think it was probably hidden in different forms, just like other mental health difficulties. I think everyone faced sort of a burnout. And burnout doesn't necessarily have to come from your professional work, I think. I think it is as individuals, as human beings, having to navigate life I think you have these sort of, I mean, I just 2 days back, I had a family who came in, and and they were really struggling with this young 14-year-old who was having lots of risk-taking behavior, is on the autistic spectrum. And what was one component of it that really struck a chord for me is both the parents were medics.
Mm.
And they were really struggling. They were really struggling, both holding very high profile sort of jobs, and saying that we're getting burnt out. We can't manage our work at the moment. And I was thinking, so sometimes it's a component of life coming in. So I think burnout happens for all of us, but it happens a little bit more if you are, say, a medic and you're listening to everybody's difficulties day in and day out. So what I do is I do all these sort of things that I recommend people. So, it's general good lifestyle habits. So I do my meditation every day. You have to look after your mind. If you don't look after your mind, then, it's like anything else that you have to look after. What causes burnout is an accumulation of, your thoughts, your negative cognitions, your negative beliefs, not processing things that have happened. So I do meditation every day. I recommend exercise for everyone, and I exercise whenever I can. If I did more, I would be better. But yes, those are the sort of, I think, the reflective practice that every medical student is taught. You're taught to reflect, isn't it? You're taught to reflect on whatever has happened and look at it. Now, I would add for helping with burnout, or to make sure you don't burn, that you have to reflect neutrally on some things, but from an emotional perspective, you have to be able to look at whatever has happened in a slightly, what can I say, in a slightly helpful way for yourself. So if you look at whatever has happened to you, and you meet a family and you can't do anything, you've got to be able to say, well, it's all right. Today it might feel like this. Tomorrow it gets better. I can sort of hang in there. And I think that's particularly important in my field, where you have, say, a child with and that's what, you have a child with some sort of mental health difficulties. They may not get better in a day. You may see them for a couple of years, but you work on the improvement. So what helps with not getting burnt out is seeing the little changes, holding that in mind, is being able to be hopeful. Now, someone says that, I remember one of my colleagues was sort of pointing out, what is it that we do in mental health that makes a difference? Is it your medication? Is it the fact that you did this? But actually, what is underlying all of that is the primary function, I think, which helps people feel better. And I think this is true of all doctors, is the installation of hope. So what that means is you are giving this patient or this family that things can be better. Something else can be better. You can do something, you can make a marginal or a difference, but that is always there. And I think you have to hold it in, because if you don't have that yourself, then you don't have anything to give to someone else. And then what happens? You get burnt out. So I think I don't get, well, I wouldn't see myself as getting burnt out. And I really enjoy my work, because I do think that every day you can make a difference. And you can, and I've still got that ability to install that hope, because I personally believe it, that I can make a difference. And I think that's important for the burnout. That's what gets you, on a Monday morning, I'm at work and I enjoy going to work, and I need holidays and I need regular breaks, but then I need regular breaks from, I'm happy to come back to work too. But it's that bit, I think.
I think that's just general good life advice, actually, just listening to all of that.
But it is life.
People.
But it is life, advice, and that's what I'm saying. I practice what I preach, because what else are we telling anyone else who has a chronic condition, who has something? Well, here's some medication. This will help with this component. Let's look at how we manage other components of your life. But you'd be surprised at how much of a reminder that families and children and adolescents need that, and how much you need it yourself. isn't it? Because how many of us do all the things that we recommend are good advice for everyone else? Because it is tricky. But that's what whether and that's I think important for medics. That's why you go back to mindfulness. I don't know whether there's quite a lot of mindfulness courses, a sort of an impetus that has come into I think towards right from training. I don't know whether Mohana, you'll be able to say whether in your medical school, because they were running some Ballant groups. There's quite a lot, and many of you might have heard as well, because we've come to recognize that burnout is not necessarily what happens outside you. It's about building that resilience right from the beginning. Of course, external factors do make a difference, but very often you don't have a lot of locus of control over those sort of elements. So it's working at what you can do to make a difference.
I thought it was interesting that you mentioned Ballant groups. I did want to ask, Mohana, can you talk about them for a bit, like your experience with Ballant groups? Because I've only had a bit of limited experience with them. I was just wondering how you felt about the entire procedure.
So I haven't actually attended one, but there are lots that are advertised to us very regularly at uni. I think it's a very good way to come together and sort of just share your kind of experiences in like the clinical environment. Just get some advice. It's like a time to reflect as well, which is so important. I think if there's something that's like bothering you that you saw, in a certain clinical environment, it's nice to just be able to talk about it, reflect, and share it with other people who've had similar experiences as well. Yeah.
Sort of mentioned that there's more there are many ways to do this, and and I think that's important, because I often say this, we'll go and we'll you can talk about things, and I know there are a lot of young people, and I'm including also the sort of the medical students out there, who won't find talking easy. Talking also isn't for everyone, and I often say, and that's why I talk about, when you look at burnout, I'd say it's doing something mindfully. Doesn't matter. Go exercise. You do what you enjoy. Do your mindfulness when you're sort of brushing your teeth, and all that will contribute. All that will contribute to well-being. Will contribute to not getting to burnout. So it's really good to have the Ballant groups and a space for talking. But I'm very mindful, and I suppose that not talking doesn't suit everyone. It does a few of us who like to do it and who enjoy listening as well, but it isn't for everyone either. And that doesn't mean that then you can't have other ways of managing the sort of burnout. So playing sport, you enjoy your sport. That's an excellent way to help manage whatever is happening. And you might be the kind of person who reflects in your head and lets it go. You're not the kind of person who might want to share it with someone else. That's okay too. As long as you get it into a practice of doing that regularly, it helps with burnout, whether you do it with this specialty or with anyone else.
I always think it's really interesting when we have discussions about like specific specialties, but then we move into just general advice. It's really good, I think, both for the field and just for the general population. I always really enjoy it. One thing that I really thought was interesting was when you mentioned like people who don't like talking about things, and how sometimes it can be quite difficult, especially to open up to people. Especially thinking, oh, sorry, yeah, go on.
No, that reminded me actually, because I want to forget that people sometimes think that in order to do psychiatry, you have to talk a lot, and you should be able to. But and I've only I've had a few other trainees and things. But actually, you should enjoy, if you enjoy listening, it's a good specialty for you as well. And I've often found that we have trainees who are on the quieter side, who are not great big talkers, but there is something about that they listen well because they're not doing a lot of talking. And actually a lot of patients find them really, really helpful, because they said they give me the space to to talk. And I didn't want to forget mention, because sometimes people think what sort of skills and what sort of qualities do you need to do psychiatry. So you don't necessarily have to talk a lot. And that's what I came back to that to say also. So you might be someone who likes to listen, who just likes to ask questions and know, and actually not being and just being mindful of what people are saying and managing systems without, you could be a good psychiatrist too. It's something I wanted to say particularly. And in a way, if you have that ability to look after your own mind, whatever you do, you talk to somebody, and if they tell you particularly dreadful things, you'll be able to manage it in a quite in almost like a sensible detached manner.
I think the way you mentioned detachment was really important as well. Of course, you can't really be giving optimal healthcare if you yourself are not in a good place. But I think a lot of people would find it quite difficult to detach like that, especially, treating someone in quite an objective manner. I was just wondering if you could shed some light on that.
Well, I think the medical student interviews, you get asked about compassion and empathy, isn't it? So I always think about the people say that you need to have do you need to have empathy? Should you be able to put yourself in somebody else's shoes and feel their suffering to be able to do a particular field? And I often think, if particularly in mental health, I think, if I'm going to put myself into somebody else's shoes and feel their suffering every day, God, I wouldn't move out of bed, isn't it? You might be overwhelmed by all the things that you sometimes heard or listened to. So to give you a context, so part of the work that I do, of course, you will see children and young people who are cutting themselves, who are taking overdoses, who have emotional meltdowns in your, you might see in your clinic, who are saying, if you don't do this, I'm going to die, I'm going to kill myself. I've had all these horrible, horrible things. So how do you keep that sort of detachment? And I think it links to the detachment and that installation of hope, isn't it? So there is this bit that if you get too drawn in to a story, then you've got no hope either. So that's why you have to draw a little bit of a line. So if you got drawn in fully into their suffering, about the fact that things feel very hopeless for them, they are depressed, they are very anxious, they don't see a way out of it. And if you get too drawn into thinking that's how it is, then you haven't got that installation of hope. So there is that component of where you are able to step back and say, yes, this is really hard. This is really hard, but I've seen other young people. I know things can get better. Let's look at what we can do. Let's look at what you can do that makes a difference. Let's look at little changes that we can make. Yes or no, I can't promise you that everything will get better tomorrow, but we can work on little things. So it is that every day, because remember, this is your day job, is you might have to listen to this every day. So you cultivate that's what in our part of a training we also hear about, that you cultivate a little bit of compassion. So the empathy is good, but you can't stay in the empathy for too long. Otherwise, you might get overwhelmed. That's what happens to doctors who burn out. They often have too much empathy. So they get into the suffering, but you can't stay there for very long. You've got to be able to say, well, okay, yes, they are, but what can I do? And what can I help them to do to get out of this? So, and that's why I'm saying it's important for me to practice whatever I preach. So it is, making sure that I do my meditation, my mindfulness, being aware of, when something doesn't go right, thinking about, well, what could I have done that's slightly different? How do I make sure that I don't get drawn into my own anxieties and my, when I'm having a bad day, knowing when to, when things are. So you learn that along the way.
That's honestly really inspiring to hear, just the mindset you have. And I think it's one that really needs to be shared. I think a lot of people really associate, especially when we're, preparing for interviews for medical school, reading about articles about what to do, what doctors are like, the characteristics. A lot of them mention like empathy in that way, that you have to be always putting yourself in their shoes. You always have to be like there with them, basically experiencing it with them. But of course, it puts a tremendous strain on everyone involved. And I think the way you phrase it is a really, really good way of looking at it. So it's not something that I've thought about before. So I'm really thankful that you decided to share that with us today.
I mean, one of the advantages, and this is where I think, sometimes you get some creative license as well. So when you work with children and young people, it's slightly easier than working with adults in that sense, because you can be a little playful. It's even recommended. And I think that sort of playful and a light-hearted approach to life, that is not to say that you take things lightly, but that you can take a slightly light-hearted narrative to whatever happens to you. Well, the research is that it's conducive to everybody's mental well-being for sure. It doesn't mean that you're going to laugh at your problems, but that you can, we come back to again that you can step back and look at things in a slightly, detached way.
Mm-hmm.
I recommend a lot of that. And in fact, some of the therapies that, we get trained in all the psychological therapies as part of our training. And some of the ones I've absolutely loved and I manage always to incorporate are the ones like, narrative therapies, the solution-focused therapies, which I think are particularly, they take a slightly positive approach. And that's why I went back to say, reflection is fine, but as long as if you're going to self-reflect and then you're on your experience and say, oh, that was terrible, what they said was terrible, which can happen. You say, oh, that was terrible, this happened, they said this, that, this. So now I've learned this from it's a very serious thing. Then you don't learn as much and you are slightly bogged down by it. Whereas if you can self-reflect with a slight lightheartedness and a little bit of a sort of a detached approach, or even a slightly positive, because a lot of narrative therapies and things will talk about, like, what does this say about the person that you are becoming? What does it say about you doing what is important to you as a value? So, it says those sorts of things which help build in something positive, your self-worth and your identity as well. And I think that's part of the, I think Mohan is not commenting about all these things, but one of the, of course, the most, we're talking about practicing what you preach. It's good to be a child and adolescent psychiatrist, because if you have children, then you can test out all the things that you're preaching to everybody. Then you find out how it doesn't work or how your children run rings around you, in all the things that you say and do. But that's what keeps it, and I often share that with my family. So I say, well, I'm telling you this, but children being children will might come up with something interesting, tell me about something interesting that they did. So it's keeping that sort of light-hearted sort of so, and and you can build a relationship. So you build a relationship. So I think of some of the young people I've had who are like who have self-harm, done sort of things, and they'll get into tips with you over a period of time, and they'll say, when you give me this medication, or I'll do this, and you say, well, what will you do? And they'll say, well, I might take if you don't give me, I might take an overdose. I say, well, I'll give you only a prescription for a week, then you'll have to come and see me every week, and we know you don't like that. So you can keep it, you can keep anything a little lighthearted. So life doesn't have to be, and I think that is important, because, and I often say that, when someone, comes and they've taken overdoses, they've taken, and I said, well, yeah, it doesn't sound really great, but doesn't have to be like this. There are lots of people who have come through this, and, don't give yourself too many tattoos is what I say. You can build a relationship, and then you can keep it a little lighthearted, so they don't look back at their past and think that something, they've done something dreadful, or something dreadful has happened to them. So it's keeping alternate ways of looking at them, building some positive. So I was talking about the eating disorders. So one of the things, and it also influences how you parent and how you how you lead your sort of life. So there's this, I see a lot of children and young people with autism. So they present with what is called a kind of eating disorder called RFIDs. What essentially it means is that they have sensory issues. So they don't like to eat, or they like to eat just one food. They are probably quite underweight. They don't eat healthily. And so I remember one young girl who was about 8 who ate only chocolate. Only chocolate. And I mean literally only chocolate for a while. And obviously this worried everybody and the community pediatricians. So then everybody was saying, oh, don't give her any, don't give her any chocolate. She'll be hungry, and then she will have to eat other foods. And I said, well, okay, that's absolutely fine. I'm a big believer of whatever works, with children, and you have to do what works. But I can tell you from the research and from what I know, that if you get into a tug of war with a child or a young person with autism, who's really, who can hold their values or their obsessions to this, guess who's going to win? So I said, okay, we'll say that. So, and of course, they try to withhold food from this child for about 2 or 3 days. The child doesn't eat anything. That's it. They want, and then everybody gets really worried. So then they said, what do you do? Well, I said, well, let's look at things differently. Let's look at, we know that when it comes to behavioral management, negative punishment never works. Let's try positive reinforcement. We know the principles, isn't it? Let her eat whatever she wants, but keep offering food. And in fact, if she'll try something new, and we know that actually if you stress them out, they get far worse. Children with anyone who's put under a lot more stress doesn't do better. So, and I worked with the community pediatricians to say, let her have her chocolate. That's fine. We'll keep offering new foods. And actually, if she'll try something new, let's give her some more chocolate for that. She can have that as a reward. But if she has to try something. And what happened is that once this sort of atmosphere of all this pressure on her lifted, and she was allowed to eat, she actually was willing to try what everybody offered because she got more chocolate. And because she was willing to try, then she found out that she liked more foods. And she gradually ate more food. So I think this is a very simplistic example of how actually, I say it's involved a lot of working, but it's where you use the science. You use the science, you work with your colleagues, and you understand that autism, they are not going to behave in the typical way, but you also keep it slightly more lighthearted. So it's more of an enjoyable experience for everybody. And then in the end, the parents were happier because the child was also happier. And also everything that you did happened in that sort of way. Still, but this doesn't stop every time my colleagues getting really anxious about a child who doesn't eat, or somebody else, or a parent of someone who's anxious because the child is not eating or this thing. And that's then what I've said, that you have to hold it over time. You'd say, yes, yes, I see that, but here is the reason. And we'll continue to offer, even though we may or may not get any, so it's good to be a consultant for a few years, because all those children who their parents and my colleagues sort of complained and said, oh, what's going to happen to this child? The child's not eating. And I would say, let them eat what they can. Positive reinforcement will carry with them. They're all 6 foot and 6'2" now. So I just think I'll say thank you. Thank you for and they'll always say, oh, and the families will say, then it's, you can look back and think of your experience of visiting your doctor, of having made some change, also as being a happier one.
I think the way that you talked about that, it really highlighted kind of the thought process that a really successful psychiatrist has to have, in the way that kind of everybody had their initial views about what should be done. You said, like, you're a fan of whatever works. But then just thinking in the back of your head, it's just, that's not going to work. This is what's going to work. And just taking into account both the child's experience and like treatment pathways that have been proven to work, you came up with this like reward-based system. And then of course that yielded results. But I think it's rather interesting because the solutions aren't always so black and white as they might be in other places.
No.
I think
And
that's a, oh, sorry, yeah, go on.
that is the difference, and that is what makes you a child and adolescent psychiatrist, and that's what you bring for the team, because you have a holistic training. So you are trained not only, so you're trained in the medical bits, you're trained in the research, you're trained in the autism, you're trained in working with systems, and I think that is the strength that you bring as your doctor training brings to that role. Because anybody could give this advice, isn't it? Could give advice and say, well, just make them eat or don't make them eat. But it's where you put everything together. And I think that's where your medical training helps you with that. I see still child psychiatry and all psychiatry still as a very much a behavioral science, still a science. And sometimes because I work as part of the AST pathway, and the child will walk from there, and from the waiting room, they'll come to room, and I'll say, oh, okay, the child's got autism, or child's in my head. And then, and then everybody will say, well, how are you saying that? And I'll say, well, because it's so much is about observation. It's still a very behavioral science. You're watching, you're looking at their eye contact, you're looking at their body movement, you look how they've come across, you're looking at how they're interacting. So it's so much of that is, again, the behavioral science component of it. And that's why I say it still has a very medical component to it. And that's the role that you bring uniquely as a child and adolescent psychiatrist than from your other colleagues who are working in the same setting. Because that's one question that gets asked often. Well, how are you any different from anybody else who works in camps, or a psychologist, or a nurse or someone else? How are you different? And I think that's what makes the difference.
One question I did want to ask, especially to you, Mohana, is just listening to all of this, I was just wondering how Mum's choice of psychiatry, like did that have any effect on like you wanting to go into medicine, or was it a purely personal choice? How do you feel about the field as a whole?
I think because it is so like kind of different from other parts of medicine, like she said, it does require certain qualities, a certain skill set. From my mental health placement as well, like the consultations are very different. They're a lot longer as well. Like you have more of that time to really explore everything within a patient. And of course it is so holistic as well. Like the social background is so important, and you have to think about so many other things. And you're also liaising with a lot of other members of like kind of the multidisciplinary team, and you have to liaise with schools as well, liaise with parents, liaise with social services. So there is like so much more input. And yeah, I have been exposed to it, I guess, like growing up, and also kind of all this mindfulness as well, and like reflection and meditation and everything. I've kind of been experiencing all that as well. So I'd say I've definitely gotten a good kind of picture of it growing up. Whether it's something I want to pursue is something different, but I can definitely see how it's unique and valued in its own way, definitely.
I guess he's asking, did it influence your choices of wanting to go into medicine? I don't think so.
Going into medicine, no, I don't think so. Obviously, it's its own specialty, but it is so similar in the same sense that, you're still like treating someone. Some people can come in very acutely. Some people can obviously have these very chronic presentations. I think overall, it was another unique, exciting part of medicine. So yeah, I suppose it did in a way influence me into wanting to do medicine as well.
Mm-hmm.
I found it very interesting, because I used to, if you're a child psychiatrist, you look at everybody's children, you look at everybody, and some automatic things. But I still remember the conversations and some of the things that my children used to, their comments that they used to make when they were younger. So I remember Mohana, when we were I can't remember, she must have been about 10 or something, and we would drive, and I was driving the car and taking a couple of her friends, and my son's friends are all out somewhere, and they're all chattering away in the back. And then one of them says, oh, your mother didn't say something when you did that or something. Your mother seems a lot more chill. And so then she was saying, she said, yeah, I think that's because my mother is a child psychiatrist. So I thought, oh, okay, she's going to say something, something wonderful. I've inspired. I've done something absolutely brilliant over here. So then she said, I think she goes to work and she sees lots of children with lots of difficulties. I think she thinks we are far better than that. So she's grateful. She doesn't do anything. But I think that is that bit, isn't it? So I think I was just laughing about that because that is perspective. And that's the kind of perspective you want. You want to have that lighthearted perspective on things. But as doing it as a profession, no, I think she wouldn't want to do child psychiatry. And I guess that's the bit that is important to say. It is you must like talking to people. You must want to sort of do something. Otherwise, it's a difficult job to do day in and day out, because you would always be exposed to what everybody brings. So you should be interested in it if you want to do it as a specialty.
Can I ask what you are interested in then, like the field that you would like to go into, or have you like not made up your mind yet? What are you considering?
Yeah, so I'm quite interested in obs and gynae. I just came off obs and gynae. I'm currently in my GP placement, but I just finished obs and gynae last week. So I had a 4-week placement. So it's like 2 weeks of obstetrics, 2 weeks of gynecology. And I really enjoyed it. I think for me, I'm definitely like a adult medicine person. Like I think I prefer that over pediatrics, definitely, just because of who I am. And I really like that it's a mixture of medicine and surgery, because I was considering surgery, but I don't think I want to go down the full kind of surgical training pathway. So I thought this was quite a nice mix. And like I spoke to some of the registrars and stuff, and they said like, yeah, you don't need like a massive like surgical portfolio or anything. And that made me feel better. So I didn't need to kind of, assist or do anything like that before I applied. And yeah, I just think it's just really nice. Like the obstetrics part of it's so interesting, and it's like out of all the reasons to be in hospital, like it's actually like a positive reason to be there. Like you're there to have a baby. So that part of it really attracts me to it. Then the gynecology side of it is completely different. You're there diagnosing and treating cancers, so there's the like fulfillment that comes with that. Dealing with women's reproductive issues like fertility, again, a massive component to women's lives. And yeah, I just think it's so vast, so that I don't think I could get bored, because there's so much there, and it's also so different. And yeah, I think probably at the moment women's health, but we'll see. I'm still very open-minded.
I mean, hopefully soon we'll be able to run one of these on obs and gynae, so I'd hope to see you there. Might be fun seeing your view on what's being said. But I think we can quickly wrap up here, because we don't want to really infringe on the king's coronation, which I'm sure everybody is dying to watch. But I'd just like to thank you both for joining me on Coronation Saturday, and I'd just like to wish everybody thank you all for attending. But hopefully we see you again next time we run one of these. I'll make
Thank
sure
you for having us. Thank you.
Thank you.
Yeah, I'll be making sure to update the group and update the Twitter, so news will be on there. But hopefully when this is edited and such, we should be able to upload it onto the YouTube as well. But thank you everybody for coming, and see you all next time.
Thank you.
Thank you.